Urine is a waste product that is produced in the kidneys as they clean the blood. The urine is collected in the bladder. Urine contains chemicals that your body does not need, and it can be harmful to your kidneys if it moves from the bladder back to the kidneys. Therefore, you must make sure you drain the urine from the bladder regularly. 4 to 6 times a day is appropriate, depending on your fluid intake, diet, and medication. Take your time to ensure that the bladder is emptied completely each time, as urine left over in the bladder might cause infection of the urinary tract. In this film, you will learn step by step how to empty your bladder. It is relatively simple, really, but will, of course, require some practice. Start by washing your hands thoroughly with water and soap. Remember also to wash your thumbs. Make sure you have all the equipment you will need ready before you start the catheterization. You will need a catheter of the appropriate size and a urine bag. You will also need soap with a neutral pH value, some cotton wool pads, and perhaps a mirror which can be fastened onto your thigh. Remove the cover label from the adhesive spot. Then attach the adhesive spot to a clean surface. The pouch should hang vertically and so that you can easily reach it when you are ready to use it. Open the upper end of the peel pouch by pulling the ring towards you and then downwards. To avoid spillage of the liquid inside the pouch, only peel until you see all of the funnel connector. Connect the urine bag to the funnel connector on the catheter and place the urine bag in a secure position. Pull your clothes down so you can move freely when doing the catheterization. If you are able to urinate, always try before you use a catheter. Position yourself in a way that you are able to spread your legs to allow for easy access to the urethra. Push yourself forward in the chair, and if it is easier for you, hold your legs apart with a device specially developed for the purpose. To prevent pushing bacteria into the urethra and bladder when you use the catheter, you must first clean the area around the urethra properly. This might be easier for you if you fasten a mirror onto your thigh. You can use gloves if you prefer to. Spread the labia apart and wash the opening to the urethra. Wash from front to back in order not to transfer any bacteria and cause an infection. Use each cotton wool pad only once. From now on, make sure that you keep holding the labia apart. Remove the catheter from the pouch. You will notice that the first 5 centimeters is lubricant-free, so it's easier for you to hold. Make sure that the catheter does not touch anything before you insert it in the urethra. If it does, you must use a new catheter. Touching the sink or your clothes or skin, for example, will contaminate the catheter and can potentially cause infection. To make insertion of the catheter as easy as possible, it is important that you relax. Slowly and gently insert the catheter into your urethra as you have been instructed. Make sure you use gentle movements. If you miss the opening to the urethra, you must use a new catheter. Continue to insert the catheter until it reaches your bladder and the urine starts to flow. Then continue for a few more centimeters. When the flow stops, move a little and straighten yourself up to make sure that the bladder is completely empty. Then slowly remove the catheter. If you use a regular catheter with a straight tip, it is recommended that you slowly rotate the catheter as you withdraw it and stop each time more urine drains out. This is to ensure complete emptying of the bladder. You can dispose of your catheter and the packaging in your household rubbish. Do not flush it down the toilet. If you have used gloves, throw these away as well. Wash your hands, and you have completed the process.